Hello, my name is Raquel Ravoglioli. I'm the Director of Music Therapy at Marietta College. Thank you so much for joining us today. We have a junior music therapy student who will be presenting on music and relaxation, and she'll give you a little bit of information on what music therapy is and how you can use it for yourselves. So without further ado, I will introduce Alex Conkright, our music therapy student.
Hello everybody, my name is Alex, and today I'm going to be talking to you about music and relaxation. So, stress is caused by a situation or event that's perceived by us as a disturbance of our equilibrium. Stress can be really harmful for us physiologically, as it can increase our heart rate and blood pressure, increase sweating, and it can decrease our skin temperature. Long-term, stress can lead to impaired health, such as stroke or heart attack. So, because stress can be so detrimental to our health, it's really important to learn how to cope with stress. Our ability to cope with stress relies on our past experiences and the coping mechanisms we used then. So, it's affected by our perception of the stress and its intensity, the level of social support we've received, and at the time that stressor occurs. If it's a stressor that occurs without any other stressors in your life, it's more likely to be dealt with quicker and more appropriately. But if it happens at a time where you have multiple stressors happening in your life, it's more likely that your coping mechanism will not be as wonderful. So, although stress is necessary for our lives because it makes us think about our personal development and our well-being, we really need to learn how to relax in order to make sure that the stress doesn't become an issue. So relaxation is a state of relative freedom that from anxiety and muscular tension. So, because I'm a music therapy major, I'm going to be talking to you about how you can use music in order to relax. But first, in case you missed our presentation last time, music therapy is an evidence-based practice that uses music to achieve non-musical goals. Goals in this area can include physical, social, spiritual, cognitive, and emotional domains. And here specifically, music can provide a release from tension through structured breathing for relaxation. So there are a few types of musical relaxation that you can utilize yourself and a few that you might want a music therapist for. So progressive muscle relaxation is a coached tensing of specific relaxed muscle groups. So this allows an individual to become really in touch with their bodies and teach them how to feel when their body is tense. However, if you have a bone or joint disease, this is not the method for you because it can actually cause more pain and damage. Meditative relaxation obviously involves meditation, but it can also involve visualization or imagery to bring comfort and relief. So this can be used when we want to focus on purposeful breathing and focus, and it does not require physical tightening of any muscles, but it does require some level of cognitive ability in order to use this. So the jaw drop technique, that's a tongue twister, is when you relax the face, tongue, and jaw, and this naturally spreads to the rest of the body. It's really simple and it really requires little training. However, you have to be elevated at least a little bit or it can actually block your airways because it is dealing with your throat and your airways. So guided imagery using music is where we use imagery and music to obtain relief from physical symptoms. It's been shown to be really effective in managing chronic pain, but it can have some severe negative emotional reactions, so it is best to do this with a music therapist with you. Similarly, guided imagery in music, better known as GIM, is where we relax the body to make the unconscious conscious. This does require a GIM trained music therapist or regular therapist, and it can also have really powerful positive and negative results. Awesome. So now I'm going to walk you guys through the progressive muscle relaxation that I talked about earlier. This one is called the 7 muscle group muscle relaxation. So it is best for you to make the environment as relaxing as you can. Dim the lights in your environment and eliminate all distractions in the room. Maybe go to the bathroom first, turn off your cell phone, put your pet outside. Make sure that your clothing is loose and unrestricted. This is best done laying down, but you can also do this in a chair. And make sure that you are eliminated of all other physical discomforts. Make sure you're nice and warm, or that if you're not too warm. When I tell you to, you're going to tense and tighten the muscles of the body, and then relax again. Avoid tensing any muscles that can cause injury or intense pain. Breathe in and out. And in and out. Starting with your dominant hand, forearm, and bicep, rest your elbows into the arms of the chair or at the sides of the bed you are laying on. Now, clench your fist and push your elbow into the chair or our mattress. And hold and relax. And hold and relax. Notice the reduction of muscle tension in your arm and hand. Breathe in and out. Now, take your non-dominant hand and arm. Clench your fist and push your elbow into the chair or mattress. And hold and relax. And hold and relax. Notice the reduction in muscle tension in your arm and hand. Now, we'll move to the muscles of your face. Wrinkle your nose, squint your eyes, clench your teeth, and pull back the corners of your mouth all at once. And hold and relax. And hold and relax. Pause for a moment and feel the release of the tension in your face. Now we'll move on to the muscles. Pull your chin down to your chest, but do not let it touch. And hold shoulders, the release of tension from your neck. We'll go to the muscles of your back and abdomen. Take a slow, deep breath. Push back your shoulder blades. Pull in your abdominal muscles. And hold and relax. And hold and relax. Take a moment and enjoy the release of tension. If you are seated, lift your dominant leg until it is held straight out from your body. If you are lying on a bed, lift your leg until your heel is a few inches off the mattress. As you lift, point your toes towards you and hold and relax and hold and relax. Switch to your non-dominant leg. Lift your leg and point your toes towards you and hold and relax and hold and relax. If you feel that any muscles are still tense, stretch and relax the specific muscle groups one more time. Take some time and enjoy the relaxation that you feel. Breathe in and out. And in and out. Stay in this position for a while and allow yourself to listen to the music. It may take some time to prepare your body to move after you have relaxed. Sit up and move slowly. Allow enough time to adjust your regular activity and appreciate the release from tension that you feel. Move your arms and legs gently. You have completed the progression through the 7 muscle groups. I hope that you all feel more relaxed now and that this really helped you see how much relaxation is important for our health.
Thank you all for joining us today, and thank you to the O'Neill Center for having us as virtual guests. If you would like more resources on how to use music in your own relaxation, feel free to send me an email at this contact, rr003@marietta.edu. Music-assisted relaxation can help with pain management, decreasing anxiety. The progressive muscle relaxation that we did today can be a great way to help release tension, as Alex mentioned, before going to sleep at night. I know we all have a lot on our minds right now, and we thank you for spending the time with us today. Thanks, O'Neill Center.